On the 5th day of Christmas, my naturopathic physician gave to me 5 lab results. 4 well child checks, 3 hot cold foot baths, 2 listening ears, and a happy, healthy, thriving family. Hi, I'm Dr. Michael Smith. I'm a naturopathic physician. Thank you for joining me on this, the 5th day of Christmas, or the 5th day leading up to Christmas, brought to you by a naturopathic physician. Lab results are so important for me as a provider. Really, labs give me an insight into what's going on inside a patient's body. Because I can like listen and I can feel and I can do a lot of things and understand what's going on with the patient and their experiences, their pain, their symptoms. But overall, I can't like just peek inside someone's body. So that's why I do labs. Oftentimes that's either through blood or urine, sometimes stool testing. And all of those allow for a good perspective inside the body of what's going on. It has a lot of numbers and it takes practice knowing what's in range, what's normal, what's not. A lot of different labs will have different ranges. Some will say, for example, the thyroid stimulating hormone used to test your thyroid function. Some labs might say a high level is 3.3. Some might say it's 4. Some might say it's 5. Really, there's some fluctuations, and when I'm looking at labs, I'm looking at those ranges, but also what the values are and what the values are over time. Our bodies are always changing, and it takes time for things to normalize or things to get out of control in a disease process. So taking one value in one day gives a lot of information, but it's that information over a period of time really that we can learn a lot about someone's health. And I like to look at those patterns when I'm evaluating lab results and seeing what's going on in the person's body. There's a lot of labs that we run. We meaning providers, naturopathic physicians like myself. And a lot of those include the basics. There's the complete metabolic count. There's the complete blood count. There's a lipid profile. Like I said, TSH. There's screenings for diabetes. Those are some of the basic, like the bread and butter tests that I run on a regular basis just to see what's going on inside a person's body. There's a few other tests that I personally enjoy being able to offer my patients because of the quality of information. They're not exclusive to these particular tests, but I wanted to share them with you. I kind of think of them like a present. So one of them is the Genesight test. It's a cheek swab that you can do. And what it does is it allows you to get a better understanding of which mental health medications or psychiatric medications are good for your body depending on how you process and metabolize drugs. Our liver is the organ that digests and metabolizes, breaks down all of those drug products that we don't use after we take those drugs. So but everyone's body is different. And we've often heard sometimes maybe someone taking an anxiety medication, a depression medication for a long period of time, for 6 months. Well, that's just kind of a long period of time. And after a while, it stops working. Or maybe there's just some meds that just don't click in that regard. This kind of testing, this psychogenomic testing, allows us to understand from a genomic level and knowing how our body processes those medications, what kind of anxiety medications, depression medications, stimulants for ADHD, for example, can be used, can be best for our body. This is a fun one. I like it. It's really good quality. And it's one that I like to offer my patients when they're interested in pursuing medication options, but not wanting to go through that trial and error process. So there's one. The other one that I like is one called by US Biotek. They're a great company for doing allergy and food sensitivity testing. Now, there are lots of different testing available, lots of different providers that do that. This is one of them. I really like the quality of their reports. There are some pros and cons about doing food allergy sensitivity testing. Honestly, the gold standard for food allergy testing is just simply eliminating it from your diet and then reintroducing it. See what symptoms you get. But for somebody who likes to see some numbers and some pretty colorful graphs, they provide some really great data on a lot of different foods that you might have antibodies to that might lead to an allergy or kind of a sensitivity to those. It's another great one that I like to offer my patients. I've done it a couple times, and it's great quality. It gives me some information and patients some information as well, if and when it's appropriate for that. There are others. There's a lot. I have access to a repository of tests that I can order if I want to. These are just two of them. And they shed lots of information. Are they always necessary? Maybe not really. But when they are, they provide a lot of great information for the health that's going on inside our body. So when I get those lab results back, it gives me a lot of insight into what's going on, and it's kind of a gift in a way of information that I can give to my patients. So there you have it for day 5 of the 12 days of Christmas. I look forward to seeing you tomorrow for day 6. Have a great day.